High blood pressure is often called a silent condition, and there's a good reason for that. Most people with elevated blood pressure don't feel any different day to day. There's no obvious warning sign, no pain, nothing that tells you something is off. That's exactly why so many people walk around for years with blood pressure that's higher than it should be, without ever realizing it until a routine checkup or a more serious health event brings it to light. What makes this even more common today is that a lot of the habits linked to rising blood pressure don't look dangerous at all. They look completely normal. They're built into daily routines so smoothly that most people never stop to question them. So today we're going to walk through some of the everyday habits that research and clinical guidance suggest may quietly raise blood pressure over time, explain why they matter, and then talk about some of the natural lifestyle-based approaches that doctors commonly recommend to help support healthy blood pressure. This video isn't here to replace your doctor. Think of it as a bridge, a way to help you understand what your doctor might already be telling you, or what might be worth asking about at your next visit. Let's start with sodium, since it's one of the most talked about factors in blood pressure. Sodium causes the body to retain more fluid, and that additional fluid increases the volume of blood moving through your blood vessels, which raises pressure on the artery walls. The tricky part is that most sodium in a modern diet doesn't come from the salt shaker at home. It comes from processed and packaged foods, canned soups, deli meats, frozen meals, and restaurant dishes, often in amounts people don't realize. Two people can eat what looks like a similar diet, and one could be consuming far more sodium simply based on how much of their food comes from packaged or restaurant sources. Next is poor sleep, which is talked about far less often, but is increasingly recognized as an important factor. Sleep is when the body regulates several hormones involved in blood pressure control. Consistently short or poor quality sleep has been associated with higher blood pressure over time. This is particularly relevant for people with sleep apnea, a condition where breathing repeatedly stops and starts during sleep, which is strongly linked to hypertension and is often underdiagnosed, since many people aren't aware they have it until a partner mentions loud snoring or a doctor asks the right questions. Dehydration is another factor worth understanding. When the body doesn't have enough fluid, the blood becomes slightly more concentrated, and the heart has to work harder to circulate it, which can affect blood pressure regulation over time. This doesn't mean you need to force down excessive water either. Needs vary by body size, activity level, and climate. But consistently underhydrating is a habit worth paying attention to. Excessive caffeine intake is a commonly discussed factor as well. Moderate caffeine consumption is considered safe for most healthy adults, but very high intake, especially from multiple coffees, energy drinks, or supplements throughout the day, can cause temporary spikes in blood pressure. For most people, these spikes are brief, but for someone who already has elevated blood pressure, frequent spikes throughout the day may add up in ways worth discussing with a doctor. Alcohol is another habit tied closely to blood pressure. Occasional moderate drinking is generally not considered a major risk factor for most healthy adults, but regular heavier drinking has a well-documented relationship with rising blood pressure over time, and it's one of the more modifiable risk factors once someone becomes aware of it. A sedentary lifestyle, meaning long periods of sitting with little physical activity, is another quiet contributor. Regular physical activity helps the heart pump more efficiently and helps blood vessels stay more flexible, both of which support healthy blood pressure. The absence of movement, especially over months and years, is associated with a gradual rise in blood pressure in a lot of research on the topic. Chronic stress deserves its own mention. Stress triggers the release of hormones like cortisol and adrenaline, which temporarily raise blood pressure and heart rate. Occasional stress is a normal part of life and isn't typically harmful on its own. The concern is with chronic ongoing stress that doesn't get a chance to resolve, which has been associated with sustained elevations in blood pressure over time, and with habits people use to cope with stress that can compound the problem, like poor sleep, overeating, or increased alcohol use. Smoking is one of the most well-established habits linked to cardiovascular strain generally, including blood pressure. Nicotine causes blood vessels to narrow temporarily, which raises blood pressure, and long-term smoking damages the lining of blood vessels, making them less flexible over time. This is one of the most consistently supported findings across cardiovascular research, and quitting smoking is considered one of the single most protective steps a person can take for their cardiovascular health as a whole. The regular use of certain over-the-counter pain relievers, specifically a category called NSAIDs, which includes common medications like ibuprofen and naproxen, has also been associated with modest increases in blood pressure in some people, particularly with frequent or long-term use. Occasional use at recommended doses is generally considered safe for most healthy individuals. The concern is specifically with regular prolonged use, especially in people who already have elevated blood pressure or kidney concerns, which is worth flagging to a doctor if it applies to you. Body weight is also part of this conversation, though it's a sensitive one, so it's worth being precise. Carrying additional weight means the heart has to work somewhat harder to circulate blood throughout the body, which can contribute to elevated blood pressure in some people. This is not the same as saying weight is the only factor, or that every person carrying more weight will develop high blood pressure, genetics, activity level, diet composition, and many other factors all play a role. It's simply one piece of a much larger picture that a doctor can help interpret for your specific situation. So that covers some of the habits that may quietly contribute to rising blood pressure. Now let's talk about what's often discussed as the other side of this conversation, the natural, lifestyle-based approaches that doctors and dietitians commonly recommend to help support healthy blood pressure, often used alongside, not instead of, any medical treatment a doctor has prescribed. Reducing sodium intake by cooking more meals at home and reading nutrition labels is one of the most commonly recommended first steps, since it directly addresses one of the biggest contributors most people don't realize they're consuming in large amounts. Increasing intake of potassium-rich foods like leafy greens, bananas, beans, and sweet potatoes is often mentioned as well, since potassium helps balance sodium's effects in the body and supports healthy blood vessel function, though anyone with kidney issues should check with their doctor before significantly increasing potassium intake, since kidney function affects how the body handles it. Regular physical activity, even something as simple as a daily brisk walk, is consistently recommended across medical guidance as one of the most effective lifestyle changes for supporting healthy blood pressure over time. It doesn't require intense exercise. Consistency tends to matter more than intensity for this particular benefit. Prioritizing sleep and getting evaluated for sleep apnea if you experience loud snoring, daytime fatigue, or witness pauses in breathing during sleep is another step doctors frequently recommend, since treating an underlying sleep disorder can meaningfully improve blood pressure in people who have one. Limiting alcohol intake to moderate levels, managing stress through practices like regular movement, adequate sleep, and activities that help you decompress, and reducing reliance on regular over-the-counter pain relievers when possible are all commonly recommended lifestyle adjustments as well. And of course, quitting smoking, staying consistent with any prescribed medications, and attending regular checkups where blood pressure is measured are the foundation that ties all of this together, since home efforts work best alongside, not as a replacement for, professional monitoring. It's worth being clear about something important here. None of these lifestyle steps are meant to replace medication that a doctor has prescribed. For a lot of people, especially those with more significantly elevated blood pressure, lifestyle changes alone aren't enough, and medication plays an essential role in protecting long-term heart, kidney, and brain health. Stopping or adjusting blood pressure medication without talking to a doctor first can be genuinely dangerous. These lifestyle habits are best understood as supportive measures that work alongside medical care, not a substitute for it. So, how do you know if any of this applies to you? The most reliable way is simply knowing your numbers. Blood pressure is measured in two numbers, a top number and a bottom number, and general guidelines consider a normal reading to be below 120/80, while consistently higher readings may indicate elevated blood pressure or hypertension. A single high reading, especially if you were stressed, just had caffeine, or were active beforehand, doesn't necessarily mean you have a problem. What matters more is a consistent pattern over time, which is exactly why regular checkups or even a home blood pressure monitor, if your doctor recommends one, can be so useful. If you've noticed several of the habits we talked about today apply to your daily routine, that's not a reason to panic. It's simply useful information. The most productive next step is bringing it up with your doctor, mentioning your specific habits and any symptoms you've noticed, and asking whether it's worth checking your blood pressure or discussing any of these areas further. Small, sustainable changes made with your doctor's guidance tend to be far more effective and far safer than sudden, drastic changes made based on something you saw online, including this video. To bring this all together, blood pressure is influenced by a wide combination of everyday habits, sodium intake, sleep quality, hydration, caffeine, alcohol, physical activity, stress, smoking, certain medications, and body weight all play a role, and most of them are within your ability to understand and gradually adjust. At the same time, several natural lifestyle-based approaches, from reducing sodium to increasing movement to prioritizing sleep, are widely supported as helpful additions to a healthy routine. None of this replaces personalized medical advice. Think of this video as a starting point for a more informed conversation with your doctor, not the final word on your health. If you found this helpful, consider subscribing for more evidence-based health breakdowns like this one, and let us know in the comments which habit surprised you the most, or if there's a topic you'd like us to cover next. This video is for educational purposes only and does not constitute medical advice. Please consult a healthcare professional for concerns about your blood pressure or any other health condition.